Yeah, the traditional way would be obviously surgery, that you remove the nodule. And when we say remove the nodule, we don't remove just the nodule. We remove that part of the gland which harbors the nodule. So we tend to think of a thyroid as like a butterfly-like structure in front of the
Yes.
neck, with two wings of the butterfly being two lobes. And if you just had one side affected, then we will remove just that lobe and leave the other side alone, in the hope that they'll make enough thyroid hormone so that you don't require replacement.
Gotcha.
But oftentimes there'll be nodules on both sides, and there are times when you end up removing the entire gland or most of the gland to treat the pressure effects of large nodules, or the cosmetic compromise from the large nodules.
And so the surgery would be prep the day before, I imagine, get there early, general
Yeah,
anesthesia, the whole thing.
surgeries, yes, exactly. It's general anesthesia. It's a major surgery. You're dealing with all the important structures in the neck, with your carotid artery, the jugular vein, the vagus nerve. There's a nerve that supplies the vocal cords, which is very, very closely adherent to the thyroid. And right in the neighborhood of thyroid, these tiny, tiny glands called the parathyroid glands, which control your calcium, just like the thyroid controls your metabolism. And and they are very prone to just shutting down if you disturb them. If you move them, which you have to in removing your thyroid, you have to separate them. They share the blood supply with the thyroid, so you have to cut off the blood supply and remove the thyroid so that the parathyroid will still functioning, but it doesn't always happen, and you can end up with a situation where your parathyroids will shut down and cause problems with calcium regulation. So it has the surgery. Obviously, you have to go through the surgery, which is like you said, 1.5 2 hour surgery under general anesthesia, hospital, and you you'll end up spending at least a day in the hospital, if not another night. um, and you have an incision in the neck, which typically would be about an inch and a half to 3 inches, depending on the
Doesn't
how
feel the
big
best, I imagine.
how big this nodule is. Imagine if you're doing it for cosmesis in a 20-year-old, you taking one thing away and you are replacing it with a scar, which is depending on your skin character can last for a long time. So it's not something to be you know taken lightly. It's a major surgery with major impact on your life. And of course, the immediate effect after you have the surgery, you'll be taking 1 to 2 weeks off of work. So there is a significant amount of cost associated with it.